Focus here on methods of protecting the central nervous system. So this is a nice overview slide where I'm going to talk about each of these in hopefully about 10 minutes here, but it could be nice to kind of pause the video and think about what you already know on these topics to tap into that prior knowledge. You guys already know a little bit about meninges. You've been able to see them. You've probably heard a little bit about the blood-brain barrier, and I suspect that you probably know a little bit about cerebral spinal fluid, CSF, as well. So pause and kind of get your thoughts together and then maybe play again. So here we go with the meninges. So they're specialized membranes. They do surround the central nervous system, so they're going to be specific to the brain and the spinal cord. They enclose blood vessels. They're going to provide stability, protection. So here they are. So mata means mother. So I mentioned this in one of the cadaver groups, but dura means tough. So we're basically literally saying tough mother, spider mother. There's a subarachnoid space, which I'll point out in a second. And then pia, pianissimo, and means softly. So this is the soft mother. So if you look over here, right, so we're looking at the brain. There's going to be one important distinction between the brain and the spinal cord meninges. But here's your bone. Directly underneath the bone, around the brain, you have the dura mater, which is this. Coming down here, you guys see the arachnoid mater here? So it's called that. You see all these spider-like extensions. Underneath those, you have blood vessels traveling. Cerebral spinal fluid. So it's an important space, and that is what we consider to be the subarachnoid space. And then lastly, what's going to sit right on top of the brain, I oftentimes describe it kind of like a saran wrap that wraps over the brain, is going to be our pia mater. So it's much, much more delicate. In contrast to that dura mater, which many of you had a chance to tug, it's incredibly tough. And it is going to be continuous with the sclera of the eye. So just another view around the spinal cord. So again, you've got your dura mater. Here's your arachnoid mater and the subarachnoid space. And then here is your pia mater. So the important distinction that we see between the brain and the spinal cord is with the brain. So here's the skull, and then you have the dura mater directly touching it. With the spinal cord, you have an epidural space. So here's the vertebrae, right? The bone that wraps the spinal cord. Here's the dura mater, arachnoid mater. Here's that subarachnoid space, pia mater, and then the actual spinal cord. So of course, you should associate this with an epidural injection, right? So it's kind of famous during pregnancy for giving a spinal block to prevent pain, but you can have different types of injections in this epidural space. If you're interested in seeing how it can be used for treating headaches or in the cervical region, I do have a video here that you guys can link to. So that is the key distinction. You have this extra space, and you've got adipose tissue here, as well as a network of veins, as I've indicated. So blood-brain barrier. I think this is such a cool feature of the human body. So the brain really doesn't like variation. It works really hard to try to keep as consistent of an environment as possible. And so if you recall, right, one of our glias, these are the astrocytes. So these star-like extensions and the podocytes, they're going to wrap around both the neurons as well as the blood supply. But look at how it wraps the blood supply. You see how the feet wrap tightly and you have these little slits that are formed? That is an important component of the blood-brain barrier. And so it is made up of both the feet of those cells that I just pointed out, as well as a pretty unique endothelium of the capillary walls. So here's a normal blood vessel. It's going to be fairly porous to allow for gas exchange, to allow for lipid-soluble substances to pass. With our blood-brain barrier, it's going to be much, much tighter. So you actually have tight junctions between these endothelium. So there's no pores. And that's also going to work to create a tight barrier here. Another cool image here that my face is half blocking, but it's showing these podocytes. And again, we're literally making anatomical slits or pores that is going to prevent certain substances, certain contaminants, unfortunately also certain drugs from passing. So I've got a link down here to a really cool video looking at how the blood-brain barrier does complicate treatments for conditions of the brain, conditions like Alzheimer's and dementia. We're not able to get drugs directly to many of those regions because of this blood-brain barrier. So it's a bit of a catch-22. It protects us in many ways, but it also prevents us from getting groundbreaking treatments to the areas that we need. So that's the idea behind the blood-brain barrier. So with cerebral spinal fluid, so the composition is going to be really closely regulated. And I think a lot of people underestimate how frequently we have turnover of our CSF. So about every 8 hours, we're turning it over. We like to keep not only the composition constant, but also the volume. So sometimes people who might have had an epidural injection, or maybe they did a spinal tap, which is what you're seeing here, to actually sample that cerebral spinal fluid. Remember, the spinal cord actually ends in the lumbar region. And so what you're seeing here is the end of that spinal cord, and then those spinal taps, right, they go in really low in the lumbar region, so they don't risk puncturing the spinal cord, but that they can still sample this fluid. And it can be really valuable from a clinical standpoint to assess what this composition is looking like, how it may be deviating from the norm. So a really valuable technique. But what I was going to say is that sometimes needles that come into this space can actually puncture it where it won't seal properly. I caved during pregnancy and had an epidural. This happened to me. It's not terribly uncommon, but it basically gives you a really bad headache. And I mention that only because this fluid, we have to appreciate that it's continuous from our lumbar region all the way to our brain, right? And when we lose even a little bit of volume here, it can change the pressures in our skull and in our brain. So CSF, right, it's basically creating protection. It's going to help protect us from concussions, right? So when we have a concussion, our skull basically stops and our brain keeps pushing through that CSF, and we basically get a bruise up against our brain. But if it weren't for that CSF, we would be far more vulnerable to concussions or concussion-like events on a more regular basis. So where CSF made is, remember me highlighting in a couple of the groups this choroid plexus? So you can zoom in on it here. So you've got the capillary. Here are those ependymal cells, right? Another one of those glial cells that we highlighted in the nervous system chapter. So there they are. So this is a section of the choroid plexus. And the cerebral spinal fluid forms, so it has as filtrate. And what that means is it's actually filtering the blood. And what's coming out is not only plasma, but you also have glucose, oxygen, vitamins, minerals, different electrolytes are all going to be in that cerebral spinal fluid. So it does have a really similar composition to our blood plasma with some distinctions. So CSF, and so if you zoom back out, right, you're going to find these choroid plexuses at each ventricle, right? So here's our fourth ventricle. You have a choroid plexus there. Our third ventricle, right? So all those spaces in our brain, we have the opportunity to make this cerebral spinal fluid. And that's a good point to stop. So I am going to end it here, but hopefully this helps us a little bit, guys. Sorry for the background noise behind me.